Hi, Grandma Abuela here. Today I want to talk about the Heimlich maneuver, about what to do if somebody is choking. Now, I have been CPR certified for many, many years, and now I'm actually certified as a trainer. In all those years, and I want to say I've been CPR certified probably for at least 20 years, I have never had to do chest compressions. I hope I never do have to. However, I have had to use the Heimlich. I had to use it once on a teenage daughter, and then I've had to use it a couple of times on toddlers. So first of all, I want to talk about how you do the Heimlich on, oh, I've used it 4 times. I forgot about a kid in Walmart. So we'll talk about that in a minute. Anyways, so first of all, um, with an adult or a teenager, an older child, what you do is you make a fist with one hand. You put the other hand over it like this, and I'm going to actually do this on myself because I don't have any volunteers. You put it right here, just right below that the sternum. It's about 2 inches above the belly button. So you can see this, and then you just do hard, fast, upward um, thrusts like that. If you're doing it with someone who's pregnant, or maybe they're too big for you to get your arms around them, you stand behind them to do this, then you can do it on their chest, like right there on the breastbone, and that'll work. If they happen to collapse and go unconscious, then lower them carefully to the floor, which, if they're bigger than you, that's going to be kind of hard to lower them to the floor, and you begin chest compressions, and you call 911, of course. But remember, you just make a fist, you go like this, and then it's just fast upward compressions. So the one time when I used this on an teenage girl, teenage daughter, she we were eating leftover turkey from Thanksgiving, and she took a bite of turkey and she choked on that turkey. She was immediately like this. I could tell she was in trouble. I said, "Are you choking?" She went like this. This is like the universal sign of choking, and I think people just do this automatically when they're choking. They're like, oh, I can't breathe. Anyways, I whipped her around. She was still sitting in her chair. I put my arms around her, did that upward thrust. I think I only had to do it one time, and that piece of turkey just popped right out of her mouth, and she was very grateful and happy that I had been able to help her out. Um, the other time when I had to use CPR, I was actually in a store and I was just walking down the aisle with my shopping cart, going along, looking at things, wishing I had more money. And I saw this little family over there. They had an adorable little girl. I guess that she was probably about 4 years old. And all of a sudden, she was like this, and the mama was, oh no, no. And the dad was like, ah, and she was choking. They're like, she's choking, she's choking. I hurried over because I knew what to do. They did not know what to do. And I did this quick assessment. Do I do it like an infant or like an older child? I went for the older child because she was about 3 or 4. And she was just a tiny little thing, but I put my hands behind her and I just did these little upward thrusts above her belly button, not as hard as I would with a teenager or an adult. And I think I did it twice, and this piece of candy popped right out of her mouth, and the parents were overjoyed and thanking me. And then I had my little adrenaline rush type thing. But in the moment, I just automatically did what I knew I needed to do. By the way, when I did my teenage daughter, when I helped her out, I wasn't CPR certified at that time. So, or was I? Oh, I guess I was. I guess I was CPR certified when I did that. So, anyways, that's something that they teach in CPR certification. Now, I want to talk about babies because with the baby, it's a little bit different. I have my daughter's doll here again that I've stolen. Um, so when you have an infant and the infant is choking, and I have had to do this twice with toddlers. The one was about a year old, the other one was about a year and a half, too. And I remember both times thinking, do I do this as an infant or do I do it the way I would if it was an older child? Both times I opted for the infant. And I think I only had to do this, a couple times and the item popped out. The first time, one was my son. He was choking on a piece of candy. The other one was my grandchild, and he was choking on a chip. So what you do is you take the infant, you hold their face like this and you lay them across your arm. And I'm doing this kind of awkwardly because I want to be able to show you in the camera how you do this, but you're supporting their head and neck and body along your forearm like this. And then, and I'm going to have to stand up here, you hold them like this, their head down just a little bit like this, and you do 5 slaps to their back like this. 1, 2, 3, 4, 5. So she's at a downward angle and I'm doing a downward back thrust. 1, 2, 3, 4, 5. I only had to do that 2 or 3 times and the item popped out with with my child and my grandchild. If it doesn't come out, you put your hand here, your forearms along it, you flip her over, and then you do the chest compressions between the nipples. 1, 2, 3, 4, 5. Flip her over. 1, 2, 3, 4, 5. And just continue doing that. If you don't get it out in the first couple of rotations, I would probably call 911. If she does go unconscious, then you begin chest compressions. Now, I know a lot of times when people are choking, they say, oh, do this blind finger sweep into their mouths. Don't do that. However, if they are unconscious and you know they've choked, you can open their mouth and look inside. If you can see the item and you can get it out safely and easily, go ahead and take it out. But if you can't see it, or if it's lodged back there and you can't just grab it, then don't do anything because you don't want to lodge it farther back there in the throat. Let the professionals do that when they come after you've called 911. I hope that helps. Again, I would highly recommend that if you haven't taken a CPR class, that you take one. Even if you don't get CPR certified, at least take the class so that you have these basic life-saving skills because you never know when you're going to need